Okay, so have you ever noticed how your face twitches or your eyes blink the moment you taste something sour like lemon? So there's actually a science behind it. So when you taste something sour like a lemon or a sour punk, the sensation is detected by the taste buds that's on your tongue, especially on the lateral sides of the tongue. And these signals will travel through the facial nerve via the chorda tympani and the glossopharyngeal nerve to the brainstem. Now, they reach the nucleus tractus solitarius in the medulla, and then they continue to the gestatory cortex. Now, at the same time, the input will also go to the salivatory nuclei and the limbic system. So actually, the sour taste comes from the hydrogen ions, the acidic hydrogen ions that are going to activate the acid sensing ions. These are the channels, and we have TRP channels on the taste cells, basically on the taste buds. So these are going to trigger a reflex that increases salivation and causes facial muscles to contract. Now when the facial muscle contracts, at the same time they produce a classic grimace or a blink, or this is actually a subconscious protective reflex that is mediated mainly by a facial motor nucleus. So similar reflexes are seen when you eat something bitter, or you see some startle responses that we have when we eat something very sour, and something that may trigger this. So clinically, this reflex is important. If the facial nerve is damaged, like in cases of Bell's palsy, or the reflexes are absent, right? Also, at the same time, if there is loss of taste for some patients, like if there is zinc deficiency or post-COVID effects during COVID, patients were losing their taste sensations, this response actually gets reduced. So doctors have long used this simple reflex as a practical tool. Now, by giving patient a small piece of sour to taste, they can quickly check if the facial nerve functions without using any equipment. So this test actually can give you clues in early nerve lesions or brainstem pathology. Read about it.